Welcome back to Health Tips, folks. Today's topic is binge eating disorder. While it may not come up in a discussion often, binge eating disorder, or BED, is a serious health issue that affects about 1 out of 50 people worldwide. Knowing the signs of BED can help you recognize it early when it afflicts you or a loved one, so that it can be stopped before it leads to serious complications. Before we dive deep into the topic, don't forget to give a thumbs up and subscribe to Health Tips for more useful, informative videos. Now, without further ado, let's dive deep into binge eating disorder, symptoms, and treatments. While the symptoms of BED may sound obvious at face value, they can appear to be perfectly normal personality quirks to the inattentive. If you suspect you, your child, or any loved one may be binge eating, then keep an eye out for the following symptoms. Eating more quickly than an average person. Eating alone, often due to embarrassment. Feelings of guilt, low self-esteem, etc. Eating for reasons other than hunger. Overeating regularly. Remember also that BED is typically caused by underlying mental issues. Binge eating is usually, at its core, done in an attempt to build a coping mechanism. Binge eating can be the result of stress, loss of control, poor self-image, and similar feelings. Someone with BED may also feel momentary relief when binging, but this is usually followed with crippling guilt or shame because they ultimately know this behavior is unhealthy. They may even admit they have a problem, but it may be extremely difficult for them to break the habit as long as the underlying psychological issues that they're trying to cope with have been identified. Well, many instances of BED can be traced to stress, but this isn't the only risk factor that can contribute to the disorder. Binge eaters may have serious chemical imbalances that cause the behavior. Sudden shifts in brain structure and chemical makeup can contribute to a wide range of health problems, including BED. And as with many addictive behaviors, BED seems to have the potential to be inherited as a predisposition. People whose bodies respond incorrectly to dopamine may seek out dopamine-inducing behaviors like eating with an unhealthy regularity. So if anyone in your family has had binge eating disorder or addictive behaviors in the past, your family may be at an enhanced risk. BED has unsurprisingly been linked to obesity, but it's hard to differentiate between which is the cause and which is the effect. The same overeating that leads to obesity can easily lead to a psychological dependence on the act of eating, which can in turn lead to binging. Body image, similarly, seems to have a cyclical relationship with BED. A binge eater with a poor body image may see themselves as unfixable, contributing to deeper levels of stress, which they then try to cope with by eating to cheer themselves up, thus perpetuating the cycle. As a matter of fact, BED does not necessarily discriminate between those with healthy and unhealthy histories. There have been cases of people going on extreme diets, then rebounding from those diets by binging. This, in turn, forms a habit, and the cycles that form up binge eating disorder begin. But as with many psychological disorders, the bottom line is very often stress. Whether it manifests as fear, guilt, depression, anxiety, or as a result of other concurrent disorders. Binge eating disorder often starts as a direct result of unhealthy levels of stress. Even boredom due to lack of stimulation can potentially lead up to BED and similar conditions over time. Well, at this point, it's important to note that overeating on occasion does not necessarily constitute binge eating disorder. Most people have a tendency to overeat when large amounts of free food are available, such as at certain social gatherings. This isn't necessarily problematic in and of itself. BED is defined by consistent and episodic overeating. The diagnosis typically requires that a person binge at least once a week for 3 months straight. The severity of the disorder can vary wildly, both in terms of scale and frequency, with some people binge eating twice or more per day in worst-case scenarios. Note that BED is not to be confused with bulimia, in which the patient convinces themselves that a binge can be counteracted, often through vomiting. While these disorders are similar, the health risks and psychological states are substantially different and require different treatments. Binge eating disorder has actually profound physical and mental implications. We should first address that obesity is considered to be separate from BED. While binge eating may lead to obesity, BED is primarily a mental or behavioral disorder, while obesity is a physical problem that must be treated separately. Also, not all obese people are binge eaters, and not all binge eaters are obese. BED may be accompanied by chronic aches or pains, irritable bowel syndrome, sleeping disorders, chronic depression, bipolar disorder, asthma, and even fertility problems in women. Research has repeatedly shown that binge eaters frequently suffer from additional mental and social disorders that may make it hard for them to connect with others and seek out the help that they need. This may be due to an underlying psychological cause that leads to multiple disorders, or as a direct result of the poor self-image that often accompanies untreated binge eating. Thankfully, binge eating disorder is not untreatable. With proper therapy and medical discretion, the underlying causes can be identified and dealt with, while the symptoms can be controlled with behavioral therapy and training. Different patients have different needs, so it's always advised to work with a medical professional consistently throughout treatment. Cognitive behavioral therapy is one of the most promising methods for treating BED. The general idea is that the causes or triggers of the problem behaviors need to be identified first, after which new healthy habits can be implemented to replace existing habits. One study found that nearly 80% of the binge eaters who participated were able to bounce back within 20 sessions with a trained behavioral specialist. 59% remained successful a full year after treatment. Patients who find this method of treatment to be expensive or otherwise inaccessible may opt to try a self-guided approach utilizing specialized websites, mobile apps, and manuals provided by medical specialists. While studies seem to indicate that guided behavioral therapy is more successful overall, the self-help approach has been proven to have potential for many individuals, especially when supportive peers are available for moral support. While psychotherapy may seem old-fashioned compared to behavioral treatments, it has been proven to be effective in cases that have an underlying psychological root. psychotherapy is significantly more similar to the traditional images that people associate with therapy. The focus is on finding the underlying causes and suggesting constructive lifestyle choices that may help to narrow down or counteract psychological triggers. These therapy sessions may be provided individually in the classic couch therapist format, or might be part of a group effort for binge eaters who live close together to overcome their symptoms and emotional problems as a group. When psychotherapy is successful, the results tend to be long-lasting compared to other treatments. Other than that, weight loss therapies are often proposed to those suffering from BED, but make no mistake, weight loss does not treat the underlying psychological issues. The goal of weight loss therapies is to strictly improve the physical health of the patient. This may result in better body image and could thus reduce the symptoms of BED in theory. But multiple studies have found that losing weight is an insufficient treatment for those who are suffering from full-blown binge eating disorder. There is no harm in an obese person losing weight naturally, but if you or a loved one is binge eating due to feelings of low self-esteem, stress, or depression, then you may be better served seeking treatment for the mental and emotional problems first. Dialectical behavior therapy, or DBT, treats binge eating as coming from a place of emotional distress, recognizing the disorder almost exclusively as a coping issue. The goal in DBT is to improve the patient's emotional health and ability to self-regulate. Unfortunately, the research on DBT comes from a small pool of studies. The results have been promising, but the general consensus is that more research should be done before this can be considered a standard option. Nonetheless, this avenue may be worth pursuing if the mainstream methods are repeatedly failing to produce results in a loved one. To sum up, binge eating disorder is, first and foremost, a psychological disorder. While medications and lifestyle changes may potentially help, it's advised that anyone who is or knows a person who is binge eating approach a medical specialist for assistance. This is a complicated disorder that can have many underlying factors and could lead to serious complications, so it's not to be taken lightly under any circumstances. While some minor psychological disorders are safe to handle on your own, our professional advice is to immediately seek psychological help for you or your loved one when it comes to BED. This one can spiral out of control if left untreated, so it's in your best interest to seek decisive and immediate solutions. This has been Health Tips with another helpful video for your daily life. Remember to like and subscribe to the video so that you can stay informed about the best decisions you can make for your body and mind. Remember, as always, your health, your life, your priority. See you!